So welcome back to the channel. We're in our GP clinic and just wanting to film another way for you to get skilled with your ultrasound, your everyday ultrasound. So we're doing ultrasounds every day in our GP clinic. We're pretty much scanning most of the day. I'm probably 3 or 4 in the morning, 3 or 4 in the afternoon on average in my clinic. And you come across things in all spheres of musculoskeletal, abdominal, cardiac, always interesting things to look at and that add value to your assessment and just helping people. So thanks very much for letting us film this. So we're going to show you the Quervains, which, the classic presentation, patient comes in with pain over the radial side of the wrist, Finkelstein's positive, a little bit exquisite tenderness over the APL and EPB tendons. And we have a quick look with a scan, because we've always got our scan turned on, we're ready to go all the time. Just ask the patient to tell you where it's sore, and you just straight onto the skin like this. I usually go just straight on into a transverse view, and right away you can see something on the screen. That's the tendon there, and you can see fluid around it and a little vein on top, right? So you've got, sorry, take that away. So you've got your skin at the top, some tissues, then you've got a little vein, you've got the tendon there in cross section, you've got fluid around it because it's swollen, it's a synovitis, and there's the bone down there. And notice that my scan takes up most of the picture. So I haven't got the thing right up the top there with, I've actually expanded my picture so I fill the screen with what I'm interested in. Right, I'm getting rid of dead space. And I'm using a fancy scanner, but this will work just fine with your handheld, okay? So I'm using a fancy scanner just to make it a bit easier to see on the video. Right, so we've seen that. There's some interesting things you can do. If you want, you can put the color on and see, is there any, sometimes you get a lot of extra, kind of vascular activity around an site of inflammation. Gives you a bit of a clue, there's something going on there. See, you don't normally see much color around a tendon. Tendons are often avascular. This one's got a little bit, and you can always compare with the other side. The other thing you can do is you can go longitudinal. So we'll just go straight onto the sore spot again, longitudinal, and there's our tendon lying on the bone, on the radius, and there you can see the swollen area, the thickened tendon sheath with the synovial, and that's our target. That's where we want to put our steroid shot. And just for fun, we can check the other side. Thanks for that. Check the other side. And just have a look at the tendon there. Thanks. There's your tendon there. And you can see it's got a tiny amount of hypoechoic area around it. Maybe a bit of fluid there, but compared to the other side, I'll just put it straight onto the other side. See how the difference is? So you can see that on your simple scan straight away. So now we'll just move to doing the shot. So here we go. So we've got the wrist ready. We'll put on some betadine. Got some sterile gel. Sometimes you can manage these without sterile gel if you're putting the probe on distant to where you're putting the needle in. In this case, it's quite close to where the needle's going, so I would use sterile gel and just put plenty on. Pretty much can't use too much gel. You'll remember about the standoff technique that we talked about in the past, where you get a great view by not even touching the skin. For example, if I put that like that, you can see I'm not even touching the skin there, and you can get a really nice picture sometimes. Doesn't really matter too much for what we're doing, but sometimes just standing off a little bit in a sea of gel will make that clearer. So let's find our spot. So that looks like a pretty good place to try and pop a needle in. I'm going to go from here. So you see there's looks like a vein there, a vessel there. So let's have a look and see if it is. Maybe not. Can be a bit hard to tell. But just keep an eye out for vessels you might want to avoid. Then we just take a needle. So I've got some steroid with some local. I try and use the smallest needle that I can, because the longer the needle, the more sort of unstable your point of injection is. So we just use a tiny needle and a short one as we can manage. And then we're going to aim to come in from this side. So I'm going right down, kind of close to the so you notice the little prick as we do this? Yep. Just get a really good spot there on the screen as well so we can see. Yep. And then, that's right. So I'm just popping the needle in a in-plane direction, but a little sting. Well done. So I've got a little sting there, and you can sort of see a needle already on the side of the screen. In fact, it's already in the zone. See, I'm injecting. Don't really need to. And we're donutting the tendon, if you like. It's all going into that bursal, into that fluid space there. Popping in a mil, so it's 10 mgs of depomedrol, and the rest is local, made up to a mil. That's it, and then we just come straight out. So finished. You can see how fast it is. There's lots of talking, but the actual procedure is just it happens kind of like magic, really quick. And then normally just sort of just gently work the tendon. Sorry. It'll be sore until the local works. Clean it a bit. Just very gently working it. That hurts a bit, doesn't it? Sorry. Yeah. Until the local works. Yeah, that's the way. Just moving it around a wee bit. And this was excruciating, isn't it? This is what really hurts you, is doing this sort of movement where the Finkelstein test. Remember that? We did that before. That was so sore. So let's just check that. So if you would put your thumb inside your fingers, remember, like yeah, and then just relax your whole hand. Just relax your wrist. That's it. And just let me know. So if I'm doing that, how does that feel now? Pretty sore?
Yeah, a bit sore going down, pushed down, yeah.
Compared to how it felt before, how does it feel when I do it now?
Yep, that's not so painful.
Not so painful, yeah. So it starts to work straight away. You'll get more local benefit over a few minutes. So that's our procedure. Thanks for watching, everyone. Catch you next time.